Okay, good afternoon. Thank you for joining us here today for this very important and special announcement. Over the last several days, people across our community have been standing up and asking, how can we help? Where can we volunteer? Where can we donate funds? And how can we help our community in need? Because that's what people here in Monroe County do. We stand up when we see a need, and we look for ways to try to help people. And I am proud to lead a community that has this so much compassion and willingness to help. And I am proud that we have partners here who have taken up the call of action and are working together to meet the challenge we're facing, because collaboration in our community is key. I know over the last several days and weeks there's a lot of anxiety in our community, and people who are wondering, how are we going to get access to essential services that we need, and how can we as individuals and how can we as organizations step up to make sure that people in our community have what they need to be healthy, safe, and be able to get through the medical challenges and the challenges that are facing our community, our state, our country, and communities across the world. Each one of us has a role that we can play. I mean, you can see it when you go to the grocery store, when you go to and you're looking to buy essentials to bring home, and people are stockpiling up on things in their homes. But as importantly it is to take care of your family and to make sure that you have the supplies you need to be able to stay in your home for several days, if not a couple weeks, it's just importantly that you take that opportunity to reach out to your neighbor. Find out if you have vulnerable people in your community, in your neighborhood, in your family, that you're calling them, that you're checking in on them. Because not everybody in this community will have that same ability to be able to go to that grocery store, stand in line, and stockpile those supplies as you might have. That's how we can all come together and work together. We need to check in with the vulnerable people in this community. The other thing we need to do is we need to stay home. If you do not need to go out, you need to stay home and start practicing safe social distancing techniques, things that our county health director and our department, and what I've been saying for days now, is that we should not be doing needless activities where we're coming together. That's how you can help. That is a proactive thing that you can do that is helping your neighbors and helping your community, is by keeping your distance so we can slow down the spread of COVID-19. In addition to that, our community is incredibly lucky to have organizations that are stepping up and asking how we can help as well. And we are very lucky in Rochester to have the United Way and the Rochester Area Community Foundation, who have stepped up in a big way to offer, to lead and organize an effort across our community and across the region to start to streamline and organize financial support and volunteer support that's coming in, and the requests are coming in from all over our area. The best way that we're going to ensure that we're working together is by working with organizations that know how to do this and are stepping up to lead the way. These organizations are the key to ensuring that we're all working together. They have the ability, the resources, and talent to be able to marshal our efforts on the human services end of things to ensure that we're also not duplicating services. And as I said before, this is all new. We've never faced anything like this in our community. And in this time of great uncertainty, the need is great, and our community is doing what it does best. It's coming together. And that's the good news that we can share today. The good news is that we have leaders in this community, like our Congressman Joe Morelli. We have leaders in organizing people in collaboration, like the United Way. And we have leaders like the Rochester Area Community Foundation, who are taking it upon themselves. They're answering the call of duty to stand up, to organize us, and make sure that we are putting the resources together that we need to help people in our community in their time of need. We are going to get through this. We are going to get through this. And we're going to do it because we're going to do what Monroe County knows what to do best, is we're going to work together, we're going to collaborate, and we're going to help each other. So, and I'm very optimistic about that, because we are joined today by some incredible community leaders who are going to outline what they're going to do and the efforts they're going to undertake to organize us and start that collaboration. I'm going to next call up to the podium somebody who I'm so grateful to have here. It's Jamie Saunders, the President and CEO of the United Way of Greater Rochester. So, you're welcome.
Good afternoon. A moment of crisis says a lot about a person and a community. Faced with stress, uncertainty, and fear, we all react in different ways. What we have witnessed over the last several days has been strong leadership, selfless acts, and a community of caring. From our leaders, County Executive Adam Bello, Health Commissioner Dr. Michael Mendoza, Mayor Lovely Warren, Congressman Morelli, and all of the tremendous public leaders who continue to guide us through these most unprecedented times. To our first responders, healthcare workers, educators, and nonprofit providers who continue to do Herculean work on the front lines. And to our neighbors who are checking in on each other, doing errands, and offering to help. To the powerful collaboration announced yesterday between FoodLink, the City of Rochester, Monroe County Libraries, Monroe County School Districts, and the Rochester City School District, partners are coming together to ensure our children and families have access to food and safe places to go. Faced with adversity, there is no question we are a community of doers, and we are a community filled with helpers. Over the past several weeks, the team at United Way has been closely supporting our community's helpers, our amazing social service organizations that are navigating unprecedented challenges while continuing to provide essential and critical services. Most cannot close with so many lives depending on them. Our community thrives when our human service sector is strong, but right now it is hurting. It is experiencing staffing and volunteer shortages, funding gaps due to canceled fundraising events and closures, supply and resource shortages, especially bulk cleaning supplies, and concerns in anticipation of additional unforeseen challenges just around the corner. But again, we are a community of helpers, and we're seeing a tremendous outpouring of support. Our nonprofits are being stretched and are overwhelmed by this outpouring of support they cannot keep up with and cannot effectively deploy. Sometimes this can cause an unintended secondary crisis, which happens because agencies find it impossible to juggle incoming requests while working to maintain day-to-day activities under such strain. Some agencies are overwhelmed with support, while others are in desperate need. Today, United Way and our partners are putting forward 3 key efforts to support a coordinated community response to help our nonprofit and human service providers in this extreme moment of crisis. First, to help harness and guide the community's powerful desire to help, United Way is introducing a COVID-19 specific portal on our online Volunteer United resource. This will help connect caring community members with specific in-person and virtual volunteer opportunities and to see supply donation needs of local nonprofits in real time. Community members can check the website to see what's needed and raise their hands to be notified when a new need arises. Needs like helping to make 3,000 calls to older adults in a day to notify them of service changes, or packing boxes of food, or taking a shift at a food pantry, or providing diapers to a women's shelter, and a whole host of needs not yet imagined in this new world. The site is live and will be updated over the coming days with opportunities, so please check often at uwrochester.org/COVID-volunteer. We know many in the community want to help FoodLink right now with meal distributions. FoodLink is not accepting volunteers at the moment, but will need them in the future. To alleviate the pressure on FoodLink, we ask those who want to volunteer to go to United Way COVID Response website to sign up on the FoodLink wait list, so FoodLink has a ready list of helpers right when they need it. Secondly, United Way and the Rochester Area Community Foundation are coming together to activate the Community Crisis Fund in response to COVID-19. The fund will pool financial resources from foundations, businesses, and individuals and allow rapid deployment to nonprofits that are disproportionately impacted by the COVID-19 pandemic and the economic consequences of the outbreak. In just a moment, Jennifer Leonard, President and CEO of the Community Foundation, will provide further details on this critical community effort. Our third announcement today ties the work we are doing in close partnership with Monroe County to help support a coordinated community response by helping address immediate concerns of community-based organizations and help nonprofits problem solve across sectors. To this end, this week we will be rolling out the Human Service Support Hub, a hotline and online resource community for local human service agencies that will provide real-time information and updates, offer connections to thought leaders and decision makers, and enable information sharing in an easy-to-use, centralized, and coordinated way. The Human Service Support Hub builds on the work of the Monroe County Systems Integration Project, co-chaired by Congressman Morelli and Wade Norwood of Common Ground Health. All human service agencies are encouraged to engage. We are here for you, and we want to help you. Human service providers will receive information on how to participate in the next 24 hours. Those interested in joining the hub or learning more can send an email to covidresponse@uwrochester.org. This resource hub is for human service agencies. For individuals in need in the community, as always, please contact our community's central resource and referral agency, 211. There is no question these are trying times, but as these examples illustrate, the community is coming together like never before. As the county executive said, we will get through this. These tools, Volunteer United COVID Portal, the Activated Community Crisis Fund, and the new Human Services Hub are the latest in a collective response, and I am sure there is more to come. Everyone has a role in helping. There is no question we are stronger together than we are on our own, and we are so grateful to this community for standing united. It is now my pleasure to introduce Jennifer Leonard, President and CEO of the Rochester Area Community Foundation.
Thank you, Jamie, and thank you everybody for being here today. We are all in this together, and together we will make it through. Greater Rochester's nonprofit community plays a critical role in ensuring our health and safety, supporting our families, and building equity and vitality every day. How can we help them continue to serve while facing the same COVID-19 challenges as the rest of us? Rochester Area Community Foundation is proud to co-lead the Community Crisis Response Fund with United Way of Greater Rochester, which has set a wonderful example of leading and partnering. It was just last Friday. Area foundations and United Way gathered to talk about how to support FoodLink to prepare in the event of school closures to ensure students and families had access to food. Through this first action of pooling resources, we were able to disperse an initial $260,000 to help FoodLink do just that, thanks to investments from the Community Foundation, United Way, Wegmans, ESL Charitable Foundation, Greater Rochester Health Foundation, and the Farish Foundation. My, what a difference a few days and a few school closures can make. We know this is just the first of many needs which will only continue to grow and will carry on from our response to COVID-19 to our community's recovery from COVID-19. Today, the United Way and the Community Foundation are asking our community, individuals, foundations, and businesses, to join in and support the Community Crisis Fund in response to COVID-19. This fund is designed to provide rapid and flexible support and funding to our nonprofits and to help community organizations and as we recover and address future emergencies in the community. Funds will be distributed on a rolling basis as fundraising continues through the outbreak and recovery phases of the crisis, making it possible to move resources quickly and adapt to evolving needs. United Way will administer funds from the fund. United Way will administer grants from the fund in partnership with the Community Foundation and in close collaboration with its many other community partners. Details on how to apply will be posted to the United Way website in the coming days. Community members can donate to the Community Crisis Fund online by texting Crisis Fund to 41444, as well as giving online and by check. Find more details at uwrochester.org/crisisfund. The Community Foundation can also accept Community Crisis Fund contributions, including online at www.racf.org/crisis. Together, we will defeat this pandemic and build Greater Rochester for tomorrow. Let's make sure our critical community partners stay right there alongside us. Now it is my pleasure and honor to welcome our beloved member of Congress, Joe Morelli, to share his support.
Thank you, Jennifer. Good afternoon, everyone. Let me begin with some observations and some thanks. First to the County Executive, Deputy County Executive Corinna Crossdale, who's here. The county team has been extraordinary in my view. Over the last several weeks, they have been not only quick to make decisions, but have communicated, I think, incredibly well with the people in this community who are really trying to get their heads around, I think, as we all are, the nature of this, the seriousness of this. And I think the County Executive Adam Bello and his team have been examples of really thoughtful, progressive, dynamic leadership, and I want to thank them. They have put in long hours over the last several weeks, and I know many, many long sleepless nights await them, but I want to extend my thanks. I also want to extend my thanks to Jamie Saunders at the United Way and Jennifer Leonard at the Rochester Area Community Foundation. I often say to people that I have the incredible privilege of representing one of the greatest communities in the United States, and I firmly believe that, and today is another indication of why I feel that way and why we are such a special community. And I do want to underscore something the county executive said, which is to remind people how serious this is. What we're dealing with is an international pandemic. We have in some ways in the United States just feeling the tip of what this will be over the next several weeks and months. And that's not to unnecessarily frighten people, but it is to underscore how important it is that people stay home. People who are not first responders, people who are not healthcare providers, people who don't need to be at work. And this is one of the ways that we come together as different government levels to figure out how we integrate services to provide that support. And one of the critical things that's being announced today is how important it is that the not-for-profit community demonstrate leadership, and you can't think of better partners than the United Way and the Rochester Area Community Foundation. I mean, this is really in some ways unprecedented what we're facing in terms of the entire world, but certainly in our community. And to have these kind of partnerships to do these services, to take up the mantle, to be working hand in hand with the county government is also unprecedented. We should be very grateful for their leadership. The ability to marshal all the volunteers, and look, there are so many people in this community who want to help out, and we're all getting text messages and emails, and it's hard to manage, but the fact that United Way is going to step up to provide that leadership, that the United Way and the Rochester Area Community Foundation are coming together to make sure that they coordinate the philanthropic urge that so many people feel in this community is again something that we're blessed to have. And the last part, which Jamie referenced, is we have been working now for more than a couple of years to try to bring together an integrated delivery system of health, education, and human services, and that architecture and that work that we've been doing makes us well situated to be able to work with the not-for-profit community-based organizations so that they can get guidance on how they fit in to this mosaic, in a sense, that we're building that is Monroe County. So I'm very, very proud of the work that we're doing collectively, all levels of government. As someone said to me a couple of weeks ago, made some reference to politics. I said, I'm pretty sure that the virus doesn't care whether you're a Democrat or Republican. And I think in this community in particular, we have worked with town, city, village, state legislators, and people of all political persuasions, because coming together to safeguard the public interest and the public health is our #1 goal. It's the oath we take, and it is our most important thing. John Kennedy once said, everyone can't do everything, but everyone can do something. And that's what we're calling on people in this community to do. And under the leadership of the county executive, United Way, Rochester Area Community Foundation, we're finding ways for people to constructively come together. And I'll leave you with this because my friend Jamie mentioned it before we walked out, referencing Fred Rogers, because in some ways we should all ultimately reference Fred Rogers, who taught us so many stories. And he talked about how, as a child, his mother would say, when you see scary things on the news, to look for the helpers, because there are always helpers. So this is an opportunity for us once again in Monroe County and the Rochester region to look for the helpers, and the people behind me are the helpers. So thanks so much for all of them for their leadership and for the incredible work that we're doing, and be safe out there.
Does anybody have any questions?
Who are the people that you're looking to serve with this partnership and with these grants? Who are those people?
Sure. We are looking to help nonprofit organizations manage through the crisis and beyond. They are having to close their offerings in some cases and step them up in others. And it's at the same time they're facing the issue of having employees try to work remotely and have all of the other issues around the COVID-19 response that businesses and organizations do, but they're expected to stay there and stay on the front lines. So the initial grants are focused on helping the nonprofit community, particularly the human service community, respond, serve, and manage through this crisis.
So it's not direct support for, say, people who lack access to food or housing. It's support to the folks who are helping those people.
Typically, it would be support to the people who are helping those people, and they may be coordinating support for just those individuals.
Adam, we received a number of emails and phone calls to our newsroom this morning about a death this morning. Many people indicating that the gentleman may have had COVID or had COVID and was isolated. Can you comment on that at all?
Yeah, what I would ask is that the media and individuals in our community and social media and everything else not speculate on rumors. Before I left to come here today, I heard the same thing and checked in, and there has been no reports of an individual who has died in our community that we're aware of from COVID-19, related to COVID-19. But reporting on rumors like that is something that I think that we should avoid doing at all costs. This is why our public health department has been very forthcoming with information every day, sometimes several times throughout the day, to make sure that we update the community on information that's accurate and all the information that we have as we know it. Because there are people in this community who are struggling. There's people in this community who have loved ones who have been diagnosed positive with COVID-19. And rumors and reports like that would obviously be very alarming to people who are going through a very difficult time. So we would obviously want to respect the wishes of families in our community, and we will have information coming from our Department of Health when information is available like that.
Do you have any updated numbers as to testing and to the positives, the negatives?
Sure.
I know in some other counties they've had a breakdown of how many they've given, how many have been positive, how many have been negative.
Right, and what we're going to do is going forward, we're going to work out with the folks here in the media a very regular timed release of this information so that we could do it 1, 2, 3 times a day on a regular basis, so it's predictable of when it comes out. Because part of the challenge that we face, that all counties and states and countries are facing, is that the information changes very quickly. I could stand up here today and tell you how many people we've tested, that we know that we've tested in this community, but by the time I get back to the office, it will be different. And then when you report it on the 5 o'clock news, it'll be all wrong. So I think the best way to do this is to do this periodically. I'll answer the 2 questions specifically, though. In terms of the testing, It's a difficult number to give you. The Public Health Department can give a range, and they'll update that later tonight, particularly because we have so many additional resources that are doing the testing between the hospital systems and private labs, that information flow goes to one place that then can aggregate that, so we can release that tonight. As far as the number of positive cases that we're aware of, since our press release last night indicating we have 10 positives, we've been made aware of one more additional positive case in Monroe County. I do not have details about that case. I would leave that to our Department of Public Health to release that. And obviously, if we receive information about additional positive cases, today we would release that tonight as part of our regular public update. But what I can tell you is that the Department of Health has been in contact, as they have with all the other positive cases, with individuals that through their community, through their contact tracing, that would need to be quarantined and take other precautions for their family.
The governor just had a press conference where he asked counties and municipalities to put 50% of their workforce at home and to provide face masks for all emergency responders, police, firefighters, EMS. Are you able to do that? How close to reaching those goals are you already?
Yeah, we've been working with that internally for the last couple of days with our and how we would handle county staff. I think what the governor announced today is 100% right, and that would be our goal to do that because, as I said at the beginning of this press conference, social distancing and encouraging ways to move people away from each other is what they're recommending as the best way to stop the spread of COVID-19 and the coronavirus. So we will be working to implement that with our non-essential personnel in county government to make sure we're meeting their needs. We also, through our Emergency Operations Center, are communicating with our first responders to make sure they have the supplies that they need, and we're coordinating with them. And we're also coordinating with our hospital systems to make sure that if there are supplies that they may start running low on, that we play our role to help coordinate that response and be able to make sure they stay supplied as well.
Where are we on numbers of supplies? Do first responders are there enough PPEs in the community for people to be equipped with what they need?
Yeah, we can manage that through the Emergency Operations Center, and that is what we do. We meet with representatives from the various first responder communities, from police, fire, EMS, and on a regular basis now to manage that information flow to make sure if the county has those resources, we could push it out, or if we need to make requests to the state, we could do that as well.
Do we need to make requests to the state?
We make regular requests of things such as, right now, we're working on hand sanitizer as a big one. Part of what we announced yesterday was that Monroe County, because we were one of the first, I think, to get a shipment of the New York State hand sanitizer, we were able to get that out to the rec centers and to the schools that were open today for the grab-and-go food distribution. So we're obviously requesting more, but right now we're meeting the needs that we have.
What are we doing to make sure that there's enough hospital beds in case this thing just blows up?
Yeah, the hospital systems are working on that, and that's as more and more cases become identified and positive, this is going to be a challenge that faces our community like it does across the state and the country. And this is something that the hospital systems are working on, and I refer you to them for the specific number of beds that they have available. But I'm confident in our hospital systems and their ability to treat patients here. But this is also why it's important to you hear a lot about flattening the curve. That's a term I think we're all becoming familiar with. That's where this community has a responsibility. The hospitals have a responsibility to treat people who are sick. We have a responsibility as government leaders and community leaders to pool our resources and coordinate the effort. And our community and individuals in our community have a responsibility to work with us to flatten that curve, to create issues of social distancing, to follow the orders. When the governor announced today, rightfully, that bars, restaurants, and other organizations should close to dine in tonight at 8 o'clock and be carry out and take out, that is absolutely right. That is the right move we should have. People should not be going and congregating at restaurants and bars. That is not safe social distancing. But having said that, we should also be patronizing these businesses. This is going to be tough over the next several weeks and months. Utilizing takeout services, Grubhub, DoorDash, whatever the things you do. Those are things we should do to support businesses. But congregating in bars and restaurants is not a good idea. And that is where the community can band together to help. Because as I said, we will get through this. This is something I have complete confidence in our community. Rochester has risen up and faced challenges, and Monroe County has over centuries and generations. We will persevere, and we're going to do so because we have nothing but the best people in the world, and I fully believe that, and we have nothing but the best leadership in the world as well. Congressman Morelli said, this virus knows no bounds, does not know Democrat or Republican. And that is true. I've worked with local officials all across this county. It doesn't matter. They're a Democrat or Republican. If we've run campaigns against each other, that doesn't matter anymore. What matters is protecting and keeping the public safe.
Are you concerned that this is going to get so overwhelming that our hospitals won't be able to have enough beds?
It's something that we communicate with the hospitals and we're coordinating on. Right now, I am confident in their abilities to treat our community, but we are looking for ways to expand capabilities. But like I said, we have a responsibility as a community. We can help manage that, right? I know there's anxiety about the hospital capacity. The governor talked about it today, about the number of beds and the surge capacity we have. But it's in addition to the hospitals work on that and the counties work on that and where we're trying to find additional resources, the community plays a responsibility too. If you're wondering how you can help by staying home. You can help by practicing social distancing techniques, and you can help by making sure the vulnerable people in this community have what they need so that they can stay in their homes and they can be healthy as well.
To Mark's point about that,
Yeah.
And this is a question for both you and the Congressman. The governor mentioned he wants counties to identify areas where beds could be set up if they had to be outside the hospital system. You know, for Congressman Morelli, he's suggesting President Trump, sort of lead that effort. But locally, he's asked you to do that. Are there places here in Monroe County?
We are very actively working on that. That was we spent an incredible amount of time yesterday, today, and over the last several weeks we've had conversations about it, but we're working on that actively today to come up with solutions for people, because we're going to have a lot more people in addition to beds, people who are going to need to quarantine themselves at home and need to be able to do that safely. Those are issues that are going to continue to grow if we can't flatten that curve. And so we're going to very actively be working on that. Yeah. Did you want to?
Yeah, I would just say this, that, the two significant legislative initiatives that we've undertaken, first the $8.3 billion emergency appropriation, which we did last week, and then Saturday morning, the House passed the coronavirus response bill, which the Senate, I believe, is working on today. The President will sign. But those are really just the first initiatives. There's going to be a whole lot more, because we're going to have to continue to look at loss of income by people, average citizens. We're obviously looking at mortgage payments and whether or not there will be deferrals, and working with the banking industry on that. There are a lot of different suggestions being talked about, and certainly the capacity of our healthcare system around the country is going to be and is a part of that conversation. I was on the phone with the Speaker's office just an hour ago, because as I work with community partners, like obviously the county executive, the United Way, the Rochester Area Community Foundation, as we learn about additional needs, I'm continuing to communicate those needs to the leadership in Washington, and as we identify new pieces of legislation, new initiatives, we're going to fold that in, and certainly the healthcare system is going to be first and foremost among those.
We're saying this isn't about politics, Congressman, but the President just tweeted that he spoke to all the nation's governors, and it went very well. Cuomo of New York has to, quote, do more.
Well, boy, I don't know. I mean, with all due respect to the President, I don't know of a state executive or governor who's done more than Andrew Cuomo. I think, and admittedly, I have a bias. He's been a friend of mine for 30 years. But in a crisis, you want Andrew Cuomo to be in charge of your state. He is aggressive. He's thorough. He's making decisions when others want to walk away from decision-making. I think he's done an exemplary job. And obviously, as I said, I have a bias, but I think if you look at Democrats and Republicans around the country, they've identified Andrew Cuomo as one of the people who has stood out here on the national level to make sure that New Yorkers are protected. So I'm not sure what the President's referring to, but we're doing everything we can, and I wish people, and I wouldn't reprimand the President certainly, but I think people need to come together and make sure that we're supporting one another, that we're uplifting each other, that we're working together, and we'll continue to do that.
Thank you.
All right, thank you everyone very much. Appreciate it. All right.
Thank you.
That was